In the context of dental fear and anxiety, one can never ignore the topic of pain. Anxiety is of a great concern for dentistry as it's considered an oral health problem, which can result in avoidance of dental treatment and eventually leading to a higher prevalence of untreated dental disease. Conventional non-pharmacological behavior management techniques have been used to manage patients with dental anxiety. Among the vast list, the emerging technique of hypnosis. Hypnotherapy is getting the patient into an altered state of consciousness, a state whereby the patient is more relaxed and more receptive to suggestion. The response during a hypnosis session is not brought about by the practitioner, but it is elected by the patient own will. Case reports on the use of hypnosis in dental treatment varies from the delivery of hypnotic scripts were done using face-to-face sessions to audio CDs. Majorities of the studies included a progressive muscle relaxation in their hypnosis scripts. Pain score in the form visual analog scale and Miguel pain questionnaire are used as a self-reporting tool. Ramazani et al. 2016 reported the use of hypnosis therapy on patients with gag reflex to control the condition and perform root canal treatment and restoration under local anesthesia in 3 visits, where first visits was hypnosis trial session without treatment involved. To authors and our knowledge, this is the first case series presenting on hypnosis as the sole anesthetic in the setting. They describe 6 oral surgery procedures performed in 3 patients with hypnosis as the sole anesthetic. In the preoperative assessment, all patients' anxiety level were assessed on the basis of the Italian version of Modified Dental Anxiety Scale and the Visual Analog Scale for Anxiety. All patients have history with successful hypnosis procedures. 2 of them has chemical or pharmaceutical allergies, and all of them are female between 30 to 50 years of age. Before a start of the treatment, hypnosis session is carried out. After spontaneously closing their eye, participants were invited to concentrate on their own body and breathe, while a feeling of their muscle relaxing was suggested. They were asked to imagine beautiful scenarios, such as lying on a sunbed on the beach on a tropical island. The hypnotic focused analgesia of the operative field was induced. The induction of hypnosis took no more than 9 minutes in each case. All surgical procedures were completely uneventful, with patients in a state of deep relaxation and well-being. They remained fully cooperative and were able to open their eyes and talk with the staff members while remaining under deep hypnosis and full analgesia. Their blood pressure and heart rate were stable throughout the procedure in all procedures. After the procedure, painkiller has been prescribed to control post-operative pain. This video is not promoting hypnosis as a replacement to conventional local anesthesia for pain blocking mechanism for clinical procedures, but to present adjunctive skills that every clinician needs to master in his attempt to provide better dental care.
Yeah, right. Good stuff. That marble staircase that you talked about before. Can you see that staircase? I wonder if you can just start slowly walking down these stairs. You can find yourself in a place where your mind can be completely comfortable. All the normal sounds and noises of the practice Just allow them to fade away as you feel the drapes going on. It's just as if you're being tucked into bed. It's a nice, comfortable feeling. Lift both of your hands up and have the palms of the hands facing each other.
After 15 minutes of relaxation, Mike uses a technique that appears to transfer numbness from Wendy's fingers to her mouth.
By thinking about the sensations and the feelings in the right hand, you can begin to change them. Can you feel any differences starting to happen there?
Yeah, it's quite pins and needles.
Kind of getting pins and needles, okay. Just allow that feeling to grow stronger and just spread into the fingers, down through the knuckles and into the fingertips. So that when I pinch just on your left hand there, that just feels normal, doesn't it? But if I pinch on the right hand there, that can feel different. How does that feel?
It just kind of feels kind of like rubber.
Rubbery, almost as if you had a big pair of marigolds on. Just raising your hand up and just allowing any sensations drain down the hand now, so this hand becomes twice as tingly as it did before. Just feel these feelings getting stronger and stronger. Can you feel that? And I wonder if when you move this up to your gum level, up at the area we're going to be working on, and just placing the thumb on the roof of your mouth side and placing the tip of your finger on the other side and just squeezing in that area and just make sure you pass all that coldness, all that tingly feeling into and around this area, okay? And you can move your hand up now and do that. Just move the hand all the way up and just take all the time you need just to allow that feeling to pass from the hand and from the fingers up into the tissues around this area. How would you describe the feelings in the left side of your face right now?
You're just stiff, as if when you burnt your finger and your skin goes tight.
Wendy uses the idea of a pain dial, registering from 0 to 10 to report the intensity of her pain. Mike uses this visualization to help her turn it down.